To your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. It's great to see you, Dr. T. Great to see you.
Too.
Yeah, it's great to see you, Dr. Ellerin. So this early data sounds really encouraging. Does it mean there's a lower risk of illness for everyone, even people who are not vaccinated? Do we know?
Really important question, Erica. I think the take-home message of both these studies, one from Scotland, the other from South Africa, is that there's a significant less likelihood of getting hospitalized from the Omicron variant compared with Delta. So the bottom line is, for an individual, you'd rather get Omicron than Delta. And I think that's really important. And, you know, your question is sort of getting at, is that true of vaccinated as well as unvaccinated? You have to remember that the majority of these people had likely been infected before or were vaccinated. So I think the take-home message is you still want to make sure that you get a dose of that vaccine or be boosted if you are fully vaccinated.
All right, so let's pick up from there, Dr. T. In Massachusetts, most of the people are vaccinated and many are boosted. So if the risk of getting sick during this surge is low, why do those who are vaccinated and boosted have to keep testing and wearing masks?
Right. So, Eddie, despite what I just told Erica, the bottom line is, even though it may be a smaller percentage of those who get Omicron get hospitalized, we're talking about an unbelievably rapidly spreading virus. So we're seeing numbers in Massachusetts and in the United States that we haven't seen before. So remember, if you have a massive amount of infections, even a small percentage of hospitalizations is going to lead to a large number. We still have about 2,000 people every day dying in the United States. This is still not influenza. So we really have to double down on our prevention efforts. We can't let up. We have to know what I do affects you, what you do affects me.
And that the hospitals are at capacity, kind of bursting at the seams. So now we want to get to questions from some of our viewers. These are their words. Here's the first one from Paula, and she writes, quote, "It's quite obvious that these variants are being spread by the vaccinated. Does that mean that Americans will be getting booster shots that don't work for the rest of our lives?" That's her question.
Okay, so what I would say to Paula is that, first of all, the majority of people who are hospitalized are unvaccinated, not vaccinated. Yes, there are vaccinated people who are hospitalized, but right now in Massachusetts, it's about 70% of all patients who are hospitalized with COVID are unvaccinated. The second point I'd like to make is, even though, yes, you can transmit these variants even if you're vaccinated or even if you're boosted, the majority of transmissions are occurring to unvaccinated individuals. We know that. So I think some of Paula's premise is not quite correct there.
And so here's another one, Dr. T. This one's from TJ. And this is a good question, and I hear this frequently. Do cloth masks protect against Omicron? Does the type of mask matter?
Well, there's no question that the type of mask matters. And the most important thing is that you have a mask that is tight-fitting and also gives filtration. So we know that the best masks that you can wear are those N95 respirators. But that's really more, dedicated to healthcare workers because they are limited in supply. The next best mask is likely those medical or surgical masks, the blue or black masks that we see, on most of us. Those have 3 layers in them, and they also can have a tighter fit.
Yeah.
Now, will cloth masks work?
Yeah.
Cloth masks are likely to work to some degree. We obviously don't know yet how well it works against Omicron, but what I would recommend is, if you are going to wear a cloth mask, I would think of doubling that over another type of medical, procedure mask.
Got it.
Like,
Yeah,
like this.
yeah, like one like we all have, and I have it here in the pocket here. See, we're hanging,
right.
hanging.
Let's see your mask.
It's in there somewhere. It's in there somewhere. It's in one of these pockets.
Better than nothing. Guys, one thing I do want to tell you is, we've worked so hard, and I want to, wish both of you a Merry Christmas and a great New Year. But we've gone through many obstacles in the past. We're going to continue. We're going to beat Omicron. But this is a cycle that we're seeing that we're going to have to continue to double down and do things in order to keep up with this. But I know the science is working, and the therapeutics and the vaccinations, the antivirals that scientists have come out with have been incredible. And I just think we have to keep doing what we're doing.
Well,
we will ultimately overcome this.
Well said, Dr. T. Great to see you. Thanks for all you have done for us. Happy holidays to you. Thank you.
Thank you, Doctor. All working together. Happy holidays to you, of course.